Ladies and gentlemen, thank you for joining us. My name is Steve Papadopoulos. I'm the Chief Medical Officer at the Barrow Neurologic Institute. And on behalf of the City of Phoenix, the Phoenix Fire Department, and the BNI, I'd like to welcome you to this celebration of the inauguration of the Barrow Emergency Stroke Treatment Unit. I'm proud to be joined today by Mayor Greg Stanton, Councilman Michael Nowakowski, Phoenix Fire Chief Kara Kalkbrenner, and Barrow Stroke Program Director Dr. Michael Waters. I'd also like to thank the staff of the Public Safety and Veterans Subcommittee, the staff from Councilman Valenzuela's office, the Phoenix Thunderbirds, the Board of Visitors, the Barrow Foundation, the Women's Board of the Barrow Foundation, and Barrow Beyond for joining us today. You'll hear today about significant, game-changing advances in the diagnosis and treatment of stroke care. This program represents life-saving and life-changing impact on our community, on the patients and families of our community. This is called the Barrow Emergency Stroke Treatment Unit. For short, we call it BEST-U. This is a state-of-the-art, fully equipped, fully connected, mobile emergency room. We have the ability to bring the full capabilities of a stroke center emergency department, including specialized personnel, expert physicians, to the curbside. It really is a true game changer. This work represents a significant partnership between one of the country's elite fire departments and the BNI, an international leader in the care and treatment of stroke and neurologic diseases. Working together, we will be able to provide the most sophisticated and the most time-sensitive diagnosis and treatment for stroke available in the world. Although this program today specifically focuses on stroke and cerebral vascular disease, the work that we are doing together ushers in a new era of collaboration, an era that will see great advances in emergency health care and services to our community and beyond. Now I'd like to introduce the Mayor of the City of Phoenix, Mayor Greg Stanton.
Thank you so much, Dr. Papadopoulos, for inviting me to participate in today's event. This is BEST-U. That truck looks awesome, doesn't it? I can't wait to see it on Phoenix Street, saving lives. This is a great, great day for our city, and it is a true partnership between the best fire department in the United States of America, led by Chief Kalkbrenner, and of course, BNI and Barrows. What a great day for our city. Phoenix is a proud partner with Barrow Neurological Institute and Dignity Health, and I know it took a lot of time, energy, and resources, but it is certainly worth it. Barrows is the best in the world at what they do, and Phoenix is truly fortunate to be your home. And as the experts have said, when a person suffers a stroke, every minute, every second is of paramount importance to increasing the chances of survival and recovery. Early intervention means everything. So this innovative partnership with the Phoenix Fire Department that will put Barrow's unparalleled expertise closer to patients whose lives depend on it is a great thing for our city. This is a partnership that will save lives. And Phoenix has become a hub for medical innovation. And now we are taking it to a whole new level by pairing the cutting-edge Barrow Emergency Stroke Treatment Unit, BEST-U, with the best fire department in the United States. This shows that when we think creatively and we work together, we will deliver better outcomes for our residents. The Best You treatment unit will deliver emergency services that is currently available in less than a dozen cities across the nation. As mayor, I am incredibly pleased that we are going to be one of those cities. According to the American Stroke Association, the likelihood of suffering a stroke doubles every 10 years after the age of 55. And although stroke is more common among the elderly, people under the age of 65 suffer strokes as well. This service could literally mean everything to you or someone that you love. As mayor, I am constantly seeking partnerships such as this one that will keep our community whole. Phoenix is grateful to Barrow Neurological Institute and to our Phoenix Fire Department for forging this important and life-saving relationship. And so next, I believe it'll be the chair of our Public Safety Subcommittee, Councilman Michael Nowakowski. Councilman.
Once again, I want to thank our mayor for all his support and his innovative ways of thinking and making these projects possible. Thank you, Greg. As I look around this bay, just looking at all the individuals that make up this team, I call it Team Phoenix approach of creating new ways of thinking outside the box. As the chair of Public Safety Subcommittee, it's an honor and a privilege to work on a daily basis with our public safety individuals. Our emergency response are a unique group of individuals that partner with the healthcare industry, doctors, nurses, firefighters, caring about our citizens and their devotion on a daily basis of helping people and of curing people. The Barrows, I just want to thank you because what I'm thinking about right now, and I'm going off script, is that 5 years ago my mother had a stroke. And I had to sit in the back of an ambulance where the paramedics were doing everything they could to keep my mom alive. And as we pulled up to the hospital, the emergency crew just came out and they started taking all the information from those paramedics. And every single second counts. And my mom happened to pass away 5 years ago from that stroke. But I believe if we would have had this technology, this tool of a best unit, that my mom probably be alive today. So we're going to be saving many moms and dads and brothers and sisters and people's lives. So I just really want to thank all of you for coming together and thinking of ways of saving people's lives, because that's what it's all about. And with that, I just really want to thank you all from the bottom of my heart and from all those family members that are going to go through some crucial times in their lives where this unit and this team approach is really going to save people's lives. So with that, I'd like to introduce to you our chief, Kara.
Good afternoon. Thank you, Councilman Nowakowski. Yes, we are all proud and grateful for this opportunity to do more for the public. This is indeed a very important occasion for the Phoenix Fire Department, the City of Phoenix, and stroke patients. As a young firefighter and EMT in the 80s, we were taught that time was the essence for stroke patients. That has not changed. It has been demonstrated that early intervention can result in a very positive outcome for patients with neurological emergencies. Our paramedics have worked and trained with the doctors and staff at Barrow Neurological Institute and St. Joe's Hospitals for decades. We share the same directive to provide the fastest, most professional medical care to our community. As emergency responders, we currently deliver a critical set of initial diagnostics to potential stroke patients. On top of that, we have a very good system in place for quickly treating and transporting our patients to the nearest and best facility for stroke care. With the introduction of the Barrow Emergency Stroke Treatment Unit, Best You, we have entered into a whole new realm of pre-hospital care. The unit behind me brings an emergency team and state-of-the-art diagnostic equipment and medication to the scene. This benefits our patients immensely. It is our hope that with our partnership with the team from Barrow Emergency Stroke Unit will result in better outcomes for our stroke patients. This is truly a step forward for service delivery to our customers. Now, I would like to introduce the Barrow Stroke Program Director, Dr. Michael Waters.
Thank you. I appreciate it. Well, this is exciting, isn't it? I mean, what a great day. What a great day for the city and a great day for the citizens of Phoenix. I'd like to reiterate some of the comments that have already been made and really thank Phoenix Fire Department for all of the assistance and the city of Phoenix. I think that it goes without saying that an enormous team of individuals have collaborated to make this a reality, and some of them are here today, and really it's not a single person's effort. There've been a lot of people who've had a lot of hands, a lot of philanthropic support, and a lot of hard work, but we're here and we're excited about it. You know, stroke is a devastating disease, and it's still one of the leading causes of death in the United States. More importantly, perhaps, is that it's the single leading cause of adult disability in the country. It really robs individuals of their independence, their ability to take care of themselves, their ability to interact and love their families and friends, and really interrupts what they're able to do in their daily life. It's devastating. What we know for sure is that stroke is a neurologic emergency, and the sooner we identify it and the sooner we initiate treatment, the more likely we can affect a good outcome for a patient who has a stroke. There are signs and symptoms. I encourage you all to read up on those, and I'd be happy to explain them myself, but it's a neurologic emergency, and if you're experiencing any of that or know anybody who is, call 911. Call 911 and we can expand our toolbox for what we can do for you. This is a very exciting development, the Best You unit, because we know that stroke is a time-critical disease. The first hour after experiencing symptoms is known as the golden hour, and far and away, the best outcomes in stroke patients occur in patients who are identified and treated appropriately within an hour. This is really a vanguard in helping to truncate the time to treatment. We are no longer dependent on a patient being transported to the emergency room. Now we are transporting the emergency room to the patient. And this is a huge step forward, and I'm incredibly excited about the possibilities, and I'm heartwarmed to be a part of this initiative and the ability to improve the stroke care that the citizens of Phoenix have available to them. And so thank you all very much. Thanks for all the assistance and the help, and this is a great day. Thanks for letting me be a part of it.
Thank you, Dr. Waters. Before we move to lunch, which is right behind us in the next room, and of course the ribbon cutting, I'd like to thank and recognize a few individuals and groups today who, without them, we wouldn't be here. Bold ideas and great community programs don't happen without significant philanthropic support. We have been incredibly fortunate. We're thankful, of course, for the financial fuel to make a program like this start and go. But more importantly, we're incredibly fortunate to have an enduring partnership with several groups and people in our community. Specifically, I'd like to publicly thank the Phoenix Thunderbirds. They supported us very early on in this project, nearly 2 years ago when we started, and they've been with us ever since and continue to be so. The Board of Visitors, the Barrow Foundation, the Barrow Women's Board, and Barrow Beyond, thank you very much. This city thanks you very much. This program started as a kernel of an idea over 2 years ago. When the work began in earnest, it transformed from an idea to a significant and very complex endeavor. There have been and continue to be over 100 individuals from from the City of Phoenix, the City Fire Department, and Barrow Neurologic Institute that actively work and contribute on the success of this program. At the risk, and I'll take the risk, of missing a few names, I'd like to recognize some key individuals. Actually, I'd like you to stand up and be recognized. From the City of Phoenix and Phoenix Fire Department, Assistant Chief Scott Kruschek, Deputy Chief Larry Contreras, EMS Medical Director Dr. John Gallagher, Assistant City Manager Milton Dehoney, and Attorney Barton Fears. Don't sit down yet. From Barrow, Dr. Philippe Albuquerque, Dr. Andrew Ducray, Program Manager Brian Killian, Bestview Clinical Program Manager Gabe Gabriel, Barrow COO Tom Bohr, Attorney Joseph Mislov, and the entire inaugural Bestview stroke team. Ladies and gentlemen, it has been my personal privilege to work together with you, and on behalf of our community, thank you. Mayor Stanton, Chief Kalkbrenner, Dr. Waters, I think it's time to cut the ribbon.
1, 2, 3.
I'm here with Dr. Michael Waters, who's going to give us a tour of this wonderful mobile unit. This is incredible and really life-changing for many people, I'm sure.
Absolutely.
So kind of walk us through what we're seeing right here and how this is really going to change people's lives.
Sure. Right now we're standing in the rear bay of the ambulance, the mobile stroke unit, Bestview, and there are several things that really make this unique as compared to your typical ambulance. Of course, there's more space in here to move and work around, so a multidisciplinary team can be approaching the patient simultaneously, but some of the very unique features are right here. This is a CT scanner, a CAT scanner, and that allows us to actually get a CAT scan of a patient in the field who may be having an acute stroke. This is a critical part of the diagnosis.
Okay, so let me ask you this. So somebody calls 911 and says, I think my husband's having a stroke. Yes. So how is this all going to work? I mean, you have one in this area. Who's going to get the first pick and being able to actually call to make that call?
Right. Well, we're actually coordinating with Phoenix Fire Department.
Okay.
And so we've got a very nice collaboration with them. They have the call center. They initially take a call for a suspected stroke, and then we would be dispatched simultaneously with their unit and meet at the scene. And we have about a 20-minute radius from BNI, and so we actually can cover a good portion of the valley with this unit.
This is incredible news, again, for a lot of potential stroke patients, and it really, it is a matter of life and death, or just paralysis and all the things that do come with stroke. So this CT scan, so can you do this as you're moving it at the same time? Are you stationary and then you do the test and then you move?
No, the truck will be stationary and it will actually be leveled. It has leveling capabilities. Patient would be placed on this gurney here, and then this unit actually moves. So it's on wheels, it's on tracks. You can see that at the floor, and this would move and encircle the patient's head in this small hole right here. Now the unit is stationary. We have CT technologists who run this unit for us. The cab would be not occupied except for anybody except for the patient for radiation safety, et cetera. And then we are able to very quickly acquire a head CAT scan and also angiographic imaging of the blood vessels in the head. This is a critical part of the stroke diagnosis.
So this is all part of the diagnosis when the cab is actually standing. Who are the part of the personnel and the medical team who's actually caring for the patient at the time?
Okay, so again, a collaboration with Phoenix Fire Department.
Correct.
So they would also deploy a unit, and they would have their EMTs and paramedics
working
on
together.
the scene.
Got it.
This unit will also be staffed with a few RNs, so nurses, as well as a CT technologist.
Okay.
And so that's the personnel that's actually on the scene helping to take care of the patient. Here's another unique thing about this. If you can turn around, you can see that there is a monitor here hanging from the
Oh,
ceiling.
is it right coming down right here?
Yes.
Okay.
Exactly right. And I won't lower it, deploy it right now because I don't know that there's enough room. But on this monitor will be a physician, a vascular neurologist.
It's like, it's
Will be on the other
telemedicine,
side.
it's telemedicine, mobile medicine, things that they talked about years and years and years ago. I remember at NIH, my husband was a patient there years ago, and they talked about things like this. We're like, wow,
It's
that's
here.
really going to happen, and now it's
here. So that you're exactly right. This is telemedicine, and you will be connected through the cloud, and I will be able to see not only the patient and interact with the staff and do an exam in conjunction with the staff that's here on the scene, but I will actually be able to see the results of the CAT scan of the head. And so those images will actually be transferred to me so that I can not only see and talk to the patient live, but see the images from the CAT scan.
Okay, again, mobile unit, this is all stationary to assess the patient, just to figure out where the diagnosis, where we're at. When does it actually move and transport it to the hospital?
So after the diagnosis is made,
Correct.
then there's a decision as to whether or not the patient is a candidate for TPA therapy. This is the clot-busting medication. It is the FDA-approved medication for ischemic strokes. And the sooner you get it, the better the possibility of a good outcome for the patients. And we would be able to initiate that treatment in the field at the curbside before even having to transport the patient to the hospital. And that really is the log jump in terms of therapy for a stroke patient.
This is just unbelievable. Talking about cutting edge medicine. I mean, they are bringing the hospital to your doorstep.
That's exactly right.
If you will.
That's exactly
and will
right.
not move, will not transport until that patient is stable, and then we get it to the next stop where there's more equipment, more team, more
additional
medical.
diagnostic
Exactly.
capabilities,
Okay.
additional treatment options as well.
Yes.
But this will allow us to at least initiate treatment with TPA in the field.
Well, this is very, very exciting for the city of Phoenix, our entire community, for the state of Arizona, because this is 1 out of 10 mobile units in the entire country that has this operation. And it's right here in Phoenix, Arizona, the 5th largest city in the country. A lot of families, a lot of people are going to benefit from this. You guys are saving lives. You do great work. We thank you very much, Doctor, for your work.
Absolutely.
For Phoenix TV, I'm Deborah Cedillo Dugan.